Yeah, are we filming?
We're going, baby. We're
Golly, yeah.
You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET podcast.
You know what I was thinking about coming over here?
What's up?
Driving over here, is always, what are we going to talk about in these podcasts? And like we were saying earlier, it's always the same thing. I was kind of thinking about our history, if you want to call it that.
Yeah.
Neuro Night.
Neuro-Night.
Remember that?
Mm-hmm.
Yeah.
Yep.
Yeah. So when I was going through chiropractic school, we were going through I was going through the neuro program, and it is a little bit all over the place.
Totally.
And there's no real direction when going through that program. And if there's anybody listening that, is going through the neuro program, there's a lot of good information in there, but it's kind of hard to follow that direction in.
Yep.
But
I
don't even know how we got hooked up.
Oh boy.
Do you remember?
Should we say how we our usual connection?
Not right away. We got to keep this somewhat.
Yeah, we'll keep it clean
PG.
for a bit. So I think you reached out to me on Facebook and just started asking a couple of neuro questions. You just introduced yourself. You're in Palmer, Florida.
Yeah.
Is that right?
Yeah.
So, I mean, for what it's worth, there's probably 10 to 12 chiropractic schools in the whole country.
Yeah.
Something like that. This was back in 2018.
This was 20. So I graduated 2020. So yeah, 2018,
2019, I think. And so like I could still remember it over Zoom too.
Yeah.
So you reached out to me on Facebook and just kind of talk shop a little bit.
Yeah. And then I would just ask him a bunch of questions, kind of like the practical application part of it.
Yeah.
How does this look in real life?
He still asks me all these questions too.
True. But so we slowly evolved that, and Russ being the good guy or Dr. Teams being the good guy that he is, he wanted to set up something with our whole school. So we had our little functional neurology club. I was the president of the functional neurology club, and people would always ask me all these applications, and I had no real world experience with it. So we linked up. We all went to our buddy Manny's house. Shout out Manny.
That was Manny's?
That was Manny's house.
Nice.
Yeah. So we went there. We got some adult beverages.
Mine was
passed
whiskey.
them around. Yep. And we just kind of went back and forth through the Zoom and talked about a bunch of questions.
Yeah.
And that was kind of the first big step in our relationship.
Yeah, it was.
And
Well,
long story.
It was cool.
Yeah.
What was cool about it is I was in the same boat as you were when I was in school.
Right.
So I ended up being the neuro club president pretty quick, probably like 9 months into school. And so I didn't really have any real idea what I was doing.
Yeah.
I was lucky enough to connect with an outside doc, Dr. Paul Corneri. So he was a good mentor of mine in school. And so I just interned in his office. So I had a little more of that real world application while I was in school. So I got to kind of do both the learning, the teaching, the learning, the teaching. And, we were able to grow the neuro club from a handful of people, maybe 10 or 12 to a pretty good size, like 30, 40 people. Yeah. And we had like 200 in the school. So that wasn't too bad.
Right.
But I knew exactly what you were going through. Like, how do I
What's
lead?
the
How do I
application?
do this? How do we evolve this?
Right.
And, the model that we were learning really back then was just kind of shifting out of the hemisphericity model. And what we're talking about with hemisphericity is, a lot of functional neurologists for the longest time just kind of look for the weak brain, so to speak, as if it was easy as like 1-2, right? And I know there's a lot in the literature right now about hemisphericity and different models and interconnectivity and all that.
Be careful with what you say.
Of course. But, you got to start somewhere.
Right.
And so you start with maybe adjusting on one side of the body, and then you add in some eye movements, and then you add in some other things and some body movements. And you kind of refine your exam and you go through that. But when we did that Neuro Night, I couldn't tell you how excited I was just to have, how many people did you have? Like 10 people?
Yeah, it was
people?
10, 15 people max. Yeah.
And, I had my whiskey right there and I was just sipping on it. And I remember going for number 2 when we were taking a little breather so people could go get bathroom breaks and all that.
Yeah.
And I was like, man, I feel it already. Because it was happy hour time for me. I think it was evening for you guys. And, we just had a grand old time. Like we did some exam stuff. And
that was pretty awesome. Yeah, and then from there, that was probably when I was
Probably what, summerish?
I was probably in 9th or 10th quarter at that time. And then you graduate after 13 quarters. So it was probably close to the end of my chiropractic school. But then the last quarter of chiropractic school, you go out and you intern at a clinic. And, we built this relationship, and Dr. Teams and Dr. Berry invited me out here to Arizona to work alongside of them, see how they're practicing. I've never been to Arizona before. Kind of took a leap of faith. So moved out here January 2020.
The one-way ticket.
Yeah, one-way ticket. I lived with Dr. Teams for the first 3 months.
Yep.
I know he doesn't miss me living there all that much, but we had fun. He made me some good meals.
Dude, those
Taught me
salads. The
salad.
Oh,
he would make me stuff on the Traeger, ribs,
Yeah.
but I would eat all the stuff. So it was.
We had,
but
so when you were living there, I think Dr. Jahangiri was in town, and we tried to. Well, we went to the Phoenix Open, the Waste Management Open, and I remember we tried to smoke a thing of ribs before we left.
Chimney,
right?
Yeah.
And we made we MacGyvered this chimney. And by the time we got home, we realized that it didn't work at all. So we just ruined this thing of ribs.
But the house didn't burn down.
The house didn't burn down. But that meant that we had to go back out for dinner. And we rallied and we made it. Yeah. I remember that for sure.
Yep.
So that was quite the first trip for waste management for both you and Dr. Ham.
Yeah. No, and that evolved. I mean, that was my first waste management. And this one, it was interesting for those of you guys who read the news. You could tell it was probably interesting. But from there, you guys invited me to join on the practice. I stayed on, moved into my apartment up in Scottsdale. The second I move out here, the world shuts down.
COVID hits.
So I graduate March 2020. I have my graduation at your house with Manny was there.
Well, so you were working with us for a couple of month.
For a month,
You got out here in January, right?
I got here in January.
So he moves out in January. The world shuts down in March, right as he
April
supposed to graduate. And so you graduated but didn't get to walk or any of that. You didn't even go back for it, did you? No.
I walked at your house, yeah.
Was there any lack of closure from that? Or was
well,
it just,
I won.
Kind of nice and easy.
So there's a couple awards, and I won the Clinical Excellence Award.
Obviously.
But I didn't know I won. I had no idea. 2 months later goes by. I get something in the mail, like a plaque from them. I thought it was my diploma, and then I get this. It's a pretty prestigious award, and I won it. And I'm like, well, that's cool. I wish I knew. But yeah, no. I mean, there really wasn't any closure. Or let me rephrase that. I didn't mind there was no closure.
Yeah.
Chiropractic school was a stepping stone in my life. Obviously, you work hard at it, but I was ready for the next steps.
Yep, for sure.
I knew that I was able to, graduate and finish that, but I had much bigger ideas, much bigger goals than graduating chiropractic school. And that jump started moving out here. I was over working with Dr. Teams for January 2020, and then I opened my practice in September 21.
Yeah.
So a year and a half?
Yeah,
year and 3/4.
I remember you got licensed, and we were like, hey, COVID's going on. So that kind of throws off where we were. I know we were at I think we were on a wait list when you first started, and then the world shut down. And so we're like, ooh, we're going to have to make this work. And so it wasn't the best situation for you to walk into, but you handled it like I think any successful person would.
Yeah.
And, you just kind of nose to the grindstone.
Yeah.
What's the next plan?
Right.
Obviously, you currently work with kids more so specifically.
Yeah.
But, your ability to network and meet people and get to know people who are, I would say, a good sphere of influence. Just like the way you reached out to me, you reach out to other people, and your practice started growing pretty quick.
Yeah.
And Dr. Berry and I had a practice that was different than the one you were building. And so I'm glad, and I think as we had a conversation, you were like, I think I need to start my own practice. I'm like, I think you should.
It's actually interesting how it went down. I don't even know if you know some of this, but it was, what was it? It was Thanksgiving break, Christmas break, one of the two, but I went home. And it was at a time over with you guys where it was the heart of COVID. Nothing was going on. It was a little up and down, and I was in like a time where, I was seeing some adult patients, wasn't really doing what I wanted to do per se. I went home and I could be a little bit impulsive, and I went out and I looked at probably 10 different office locations back in Jersey. And I was like, okay, Arizona was great. I have so many connections back in Jersey. My family's in Jersey. Everyone I know is in New Jersey. And I got a lease handed to me. Looked over it. The pen was right next to the paper. I could have signed it. Something in my gut was like, let's hold off. It's okay. Don't sign this quite yet. Came back here to Arizona. The week I came back, for whatever reason, things got super busy. I picked up my schedule. I got back to essentially a full schedule, and it was something, call it whatever you want in the universe, divine, whatever you want to call it. But that was like, you need to stay out here in Arizona. This is where you're meant to be. This is where you're going to build the practice of your dreams. And, this is what's going to be home. So from there, stuck to it. I got pretty busy over at the other clinic. Got to the point where we got a little saturated with kids, and it just really wasn't fitting the vibe of the practice. And transferred over and opened my clinic in September 21. And we were able to hit the ground running pretty well there. And in just the first year, we grew out of our first building. We went into our second practice. And things are great.
Now we're in our third, right? Are you in your third building or second building?
Second building.
Okay, that's the one. And it's been really cool to watch what you're doing over there. Obviously, you're like a social media icon at this point.
Come on, I don't know about that. But.
And it's just really cool to see the level of care that you provide for these kiddos and the families. With a predominant, I think it's a predominant intensive setup, right?
So our practice, so right now we're seeing one intensive a week.
Okay.
Everyone else is local. I just like the ability to see one intensive a week. Just the way our practice is set up is geared a little bit more towards local patients, but we make that schedule slot fit for the people coming in from out of town. And
for sure.
Yeah, usually it's one intensive. Sometimes we'll fit in like a mini intensive on top of that. But right now I would say probably 40% brain injuries, anoxic brain injuries, everything from birth injuries to traumatic events like non-fatal drownings, things along those lines. And then the other 40% I would say is autism, all different levels of the spectrum. Sure. And I would say that last 20% is, I would say probably 10%, maybe a little bit more genetic conditions, and don't check my math here. And then the last bit would just be ADHD, learning disabilities, things like that. We have a couple headache, migraine cases in the pediatric world.
Sure.
But right now we're not seeing any adult patients. We have one or two that we've been seeing for a while that come for maintenance. But right now we're kind of in the trenches, more so in the autism world and the brain injury world.
Yeah, and it's such an underserved community. So
Absolutely.
I'm sure you have your hands full on that side of things. But with Dr. Bor, just watching him, being in the same clinic for like a year, just watching him with kids is pretty incredible for somebody who doesn't have kids.
Well, I got my cat.
That's true, Cersei, right?
Cersei. Sorry.
For somebody that doesn't have kids, you have like an innate ability to take care of them, which is really, really cool.
That's the thing. It's people growing up definitely haven't seen this side of me all that much.
You mean your football boys?
Yeah, I grew up playing football. I played college football. I don't know if I grew up being the nurturing type per se, but me working with kids, it almost lets me express my true self.
Yeah.
I could be professional and put together and all that, but I like being able to step back a little bit, being able to connect with families and kids, and sometimes act like a kid.
Yeah.
And that's one of the best things therapeutically that you could do when working with kids.
Yeah.
Is not always you're not always going to get the perfect eye movement or the perfect compliance, where if you're able to meet them where they're at while still being able to push them, that's the part of being a pediatric therapist that I don't think you could teach per se. Right. I think, there's some things within a personality which makes somebody more apt to do that. And somehow, some way that landed with me.
Worked out. It's all.
And it's also actually, also with NeuroRESET.
Just kidding.
But what I think also has helped me exponentially is my singing abilities.
Oh,
Doc Teams knows about that. He was started the OG African Nights. But
oh my goodness.
Yeah, no. Any patients watching this, my singing abilities. Actually, funny enough, I have two uncles that are chiropractors. And my one uncle, I don't want this to get millions and millions of views. If I start singing, that's what will happen.
Listen, if you guys go see Dr. Bor, you're going to have to ask him.
It's my karaoke song.
You're going to ask him if he can sing that.
That's my karaoke
So you have two
song.
uncles.
But yeah, two uncles. The one, so they're both great chiropractors, and they have very different practices. But the one, he sings too. So it's in my DNA.
Oh, Lord.
But he does more classic rock and all that. I'm more Frozen and
Baby Shark.
I'm over my Baby Shark days.
Baby Shark.
That was from the old clinic.
Yeah.
But Moana is up there
forget
these
that.
days. We got some High School Musical that's been making its turnaround.
Mm-hmm.
But yeah, no, I mean it's all a matter of having fun with these kids.
Yeah, for sure.
And the environment that we're working in sometimes can be very overstimulating.
Yeah.
And sometimes you have to be able to do these things to
Just
keep your mental to be what it's
cool,
at. Keep your
redirect, get their
Exactly.
attention. Yeah, that's cool.
Exactly.
No, that's super cool.
Yeah.
So tell me about what is, like, for people that maybe haven't heard of this stuff before, like an intensive or anything like that. What does an intensive look like for some of these kiddos with some of these injuries?
Yeah, so an intensive is essentially when we fit an entire care plan within a week's time. Mm-hmm. So our intensives, we go 4 days. We go 3 to 4-ish hours a day. And we go primarily 2.5, 3 hours in the morning, and then we come back. We break for lunch, we come back, and we do another session in the afternoon. And the goal of an intensive is to be able to make that neuroplasticity, which is like changing the brain, happen in the positive direction, to give it that boost in the right direction. So to make neuroplasticity happen, you need time, you need intensity, you need duration. You need to put all those pieces of the puzzle together to be able to change your brain.
Sure.
Now, when we are able to compact that into a smaller time frame, we're really able to push all those principles in the right direction. Mm-hmm. So we're able to start seeing some cool changes in a couple of days just because we're flooding the brain with so much new and good, advantageous information.
Like not giving it a chance to go back to where it was.
Right.
Yeah,
right. So we're really pushing that ball. So if this may not be a good example, but think about you're trying to push a boulder. Mm-hmm. If we're coming in weekly, and we may have 3-4 people pushing the boulder, which we're getting the ball in the right direction. But if we have an intensive, we may have 20 people pushing that ball, so things may roll a little bit quicker.
Yeah, for sure.
But the big thing about intensives, and I think this is a misnomer in kind of the whole intensive world, is, of course, the goal is to see positive changes within a short amount of time. But when you're looking big picture, the intensive really is a jumpstart for everything else.
Totally.
So if somebody's coming in for us, say a brain injury, and they're at home doing their PT, doing their OT, doing their whatever it may be, big picture wise, my goal is to set all of those therapies up for a more advantageous outcome, where I know if the brain's working better, those therapies are then going to be processed better in the brain. So at the end of our intensive, we come up with our home care plan, follow through with these exercises. We could even find another practitioner that uses the lasers that we have, and we co-manage with them. But intensives is putting flame on a fire and figuring out ways to keep that fire going. Yeah. But it's my job to make that fire as big as we can to make the best changes that we can.
For sure.
So when we see people with intensives, some people we see every 3 months, some people every 6 months, every year, every 2 years, whatever it may be. And that's all going to be a little bit more relative to the case. But no, big picture wise, my goal is to say, how can I set this brain up to move the right direction as quickly and as efficiently as we can.
For sure. It's super cool because you can see, we do intensives as well with adults.
Right.
But like you said, it's kind of like taking a whole treatment program and putting it into a week or two.
Yeah.
I actually do 2-week intensives now because my patient base is usually so unstable that they can't tolerate even like standing up in the world. A lot of our people will stand up, get dizzy, black out, pass out. They quit their jobs because they can't function, right? And so with that, 2 weeks for me is is really how much time we need to create stability. Right. Because we've seen, certainly with adults, when we used to do them at the old office, we would see them for a week and we'd see other people that went to other intensives and they're like, oh, I had a great week. And then I crashed as soon as I came home. Right. And so there's a lot that goes into an entire treatment program. And if you don't really cover all those bases, and don't get them far enough so that they can maintain something on their own, it's really difficult.
Yeah.
And so, but my cases often have like an end game where, we get back to a certain percentage of function and they're like, I'm golden, whether that's 90%, 95, 100, 110, whatever it is.
Yeah.
But like you deal with a different population, right? And so,
and it's interesting
how does that differ?
Because I think obviously our populations are different, but I think fundamentally there are similarities to it, just because of our knowledge when it comes to applying neurology. So what I always tell parents and patients, especially when it's a more complex case, and I know I see pretty complex pediatric cases and you see complex adult patients, but for me, it's always a matter of putting the pieces of the puzzle together. Seldom is it going to be the one supplement, the one eye exercise, the one hydrogen water that you start drinking. A lot of times with these complex cases, you have to be an investigator and figure out the ways that you're going to be putting all the pieces of the puzzle together. And sometimes those pieces could be pretty elusive, but with having that multimodal integrated type plan, we know the low-hanging fruit of the puzzles that are probably going to be fitting into this case that are going to work for most patients. And then from there, we have to, again, play investigation and figure out how we're able to put those pieces of the puzzle together.
Right.
So like for autism, for example, we know that there's an immune component. We know there's an inflammatory component. We know that there's a straight neural connectivity component. We know that there's the anxiety component. We know that there's some biomarkers that tend to be depleted with these kids with, magnesium and zinc and copper. We know that there's probably going to be some genomic-based changes with SNPs like COMT, MTHFR. We know that there's going to be some gut changes. And we could really go on and on with that. And I don't mean to say that to overwhelm anybody by any means, but the reason I like saying that is care. What's the best way to put it? You need to be able to have a care plan that has the ability to address all of those pieces of the puzzle.
Kind of like
and all of them,
right?
Right.
Like you quarterback the case.
And all of them may not necessarily even be through me. And that's why we co-manage with so many different practitioners, where if people are able to put their egos down and say, how can I quarterback the best care plan for this child or for this adult? I really think that, people's outcomes would go way up, rather than saying, this is my magic pill. If I adjust this person's neck on the left side, they're going to be better. And maybe they saw that happen one time, and then they try to fit everybody in that box. And as you know, and you obviously have a little bit more experience than I, but I'm sure that your thought process is somewhat similar to all that as well. If you want to,
yeah, it's in the neurology world. There certainly is some ego, but also in all of the medical world, right? Everything that everybody does tends to typically resonate with them, and then they're like, well, my way is the best. My way is the best. Well, when a human walks in with all these different problems, like it's going to take a community. It's going to take a tribe.
Yeah.
And so what we tend to do is try to set up phone calls with their other practitioners and just let them know what we're doing. Hey, here's what they did on their intensive. Here was the beginning. Here's the end. Here's the plan for follow-up. Yeah. They may or may not need to come back, but for you, why don't we, this is what I'm doing. You take it and run with it. Like if you feel that, because a lot of my folks have psychology related issues like anxiety. So the typical people that I work with are more on the dysautonomia kind of, I guess, group where.
Real quick, Russ,
Yeah.
do you want to talk a little bit more about dysautonomia? Because I found that people's perception of what dysautonomia is compared to what the medical world claims as dysautonomia is too, like I'm working with one kid whose autonomics are all over the place. He just had a big workup at Phoenix Children's, and they had the Holter monitor, the whole 9 yards. And there was definitely some irregularities with blood pressure and with heart rate spiking. But the neurologist says this does not classify as dysautonomia.
Okay.
So because they're not passing out, because they're not
Yeah.
having the classic signs, because their tilt table isn't exactly how they want to look at,
Sure.
is no longer dysautonomia.
Yeah, let's we can dive into that. This could be a long conversation, it'd be kind of short. I'll kind of go right in the middle.
Yeah.
So when I say dysautonomia, if you can imagine like an umbrella term, things like POTS, like postural orthostatic tachycardia syndrome, are the kind of the key or the most common diagnosis under that. And you'll have things like EDS, mold Lyme issues, all that, viral stuff, COVID stuff, post-COVID. All of this is going to interact with the nervous system. And we'll keep it simple with the fight or flight or the rest and digest system for a second, right? So like a diagnosable condition of dysautonomia would be POTS, where somebody tends to stand up, their blood pressure drops, and their heart rate cranks to try to basically equate to the normal cardiac output of just standing. Where sitting isn't as difficult and laying down is a lot easier. Most of their problems go away when they lay down. But their heart rate might not spike 30 beats to create a positive tilt test, right? So a lot of people had gone to Mayo here in the Valley, which I guess had a huge predominant dysautonomia doctor that they actually just moved. So they moved to Utah. And so they would do a lot of cardiac testing there. So a tilt table test where you start basically flat, and over the course of 5 to 10 minutes, they bring you upright, and they basically measure your heart rate and your blood pressure, and they look to see if it hits the milestones that they consider a diagnosable condition, right? So the problem is 80% of the people aren't going to test positive for this POTS-related condition. Now, there's a ton of people that have it, and it's no joke to deal with, because pretty much all they have is a beta blocker, compression stockings, and salt intake, increasing salt intake. That's literally what you're going to get at typically every cardio, right? Now, we work with some interventional and more alternative-based cardiologists that actually refer us POTS cases to do the functional neuro rehab. But the vast majority of people are going to go through the system and get the same stuff from every doctor, maybe some different meds, but most of them are directed at maintaining the symptoms. So when we look at what's actually going on with dysautonomia or POTS or whatever, basically the cardiovascular system, which in regards to your constriction or dilation of your vessels, is improperly happening. And so these vessels are controlled by the fight or flight system. That fight or flight system is controlled by your brain's activity or the strength of the brain. And within that aspect of the strength of the brain, there's an area that's basically the strongest, but it's either turned on or turned off, and that's like your amygdala. So that amygdala is our fight or flight recognizer. That's the high alert center. And if that thing is turned on or more on than it should be, you're going to deal with things like ADD, ADHD, OCD, anxiety specifically. And then that can create all the symptoms of headaches, brain fog, dizziness. I already said headaches, migraines, tingling, numbness, gut issues, insomnia issues, reactivity issues, body temperature control related issues, satiety things. So like it changes your hunger, or you're like, I'm never not hungry, right? So many people come in with their entire nervous system just dysregulated, whether it's 20%, 40%, 60, 80, or 100% dysregulated, then you're into that POTS world, right? And so we work these people up with VNG, balance, and coordination, as well as a good deep history to understand head injuries, infections, emotional traumas, and anything that can contribute. Because what we find is the three main triggers for any form of dysautonomia are going to be, honestly, the most important one to me is trauma. Usually early childhood trauma indicates, it basically sets the tone for what your nervous system is going to do, right?
And one thing, I don't know how much you dive into it, but one of the most, it's funny you say that, one of the most researched areas in the pediatric world that people don't even realize is the presence of something called ACEs, is adverse childhood experiences. And man, they are able to predict morbidity, mortality rate of so many different diseases based off of how many ACEs you have.
For sure.
And you're able to just go online and there's a simple form that you're able to fill out. It's under 10 questions or so,
Yep.
but it maps out these big early childhood traumas that really sets the tone for the rest of your life.
For sure.
So
and we'll
what-
include
just wanted
that
to add
link.
to
Yeah,
there.
we'll
Yeah.
include that link in the notes section here on the podcast. But yeah, like we've seen it for years where, let's say somebody comes in with an autoimmunity, right? Almost without a doubt, there's head injury, infection, or almost always an emotional trauma early in life. And that stuff, you so many people see, say, like psychologists, therapists, counselors, whatever you call it, and they tend to talk about it all the time, right? When what we find, and that's why we try to partner with people in the Valley that give people solid action steps to work through these psychological traumas. We work with their practitioners and say, hey, here's what we're doing. I don't think their brain is strong enough to handle this right now. That's maybe why you've been dealing with them for 3 or 4 years. Let me put them through a brain strengthening program and see what you can get to or how deep you can go down the rabbit hole after that, and they can handle it. Like, I can't tell you how many patients I've seen that we've been working together for a couple of months, maybe 2-3 months, and all of a sudden, right, quote unquote, all of a sudden, they're having these breakthroughs in therapy that they've never been able to tolerate before, right? So when that person then has that breakthrough, it addresses a massive piece of the reason why they're having dysautonomia, right? So I might be the person to directly heal-ish, right? To directly work with the dysautonomia if it's like traumatic brain injury based, like that's very straightforward. The moment psychology comes in, you've got to be very careful that you don't over activate that psychological structure, right? Which is really that amygdala. Yeah. And then that amygdala, what we say in neurology is what things that fire together wire together, right? So if you are someone who develops tingling and numbness when you get super stressed out, even if every time you have like a major emotional trauma, say a big breakup, or you get fired from your job, or somebody, you have a family issue, all of a sudden your right face starts tingling, your right arm starts tingling, people misdiagnose you with like a migraine.
So here's a question for you. We talk about traumatic head injuries, right? Do you think that emotional trauma, even the foods we're eating, chemical trauma, could almost act like a concussion as if you hit your head?
Absolutely. So right, let's just use concussion and somebody's had a trauma in the past. Let's say they've worked through it, they're really good, right? That means they had a strong enough brain to go in there, handle it, and either get rid of it or suppress it to a level that it doesn't affect them. Well, when we hit our head, we know that can break pathways, and it's going to seriously diminish your strength levels of the brain. So when that happens, those old injuries or those old traumas, boom, they rear their ugly head. So where you're like, oh, I've been fine for 10 years, you hit your head, then all of a sudden you've got debilitating anxiety, right? That anxiety shows up as anxiety, headaches, migraines, paranoia, you lose your relationships, all sorts of different stuff, right? On the flip side, something like COVID, like an infection. Yeah. I mean, viruses are historically known to just kick the hornet's nest. And usually those tend to break down systems that are like holding on by a thread. So the super, super healthy people that don't have all of the prior head injuries, prior infectious issues, or prior like traumas tend to do fairly well, which if you think about it, those 3 things cover a lot. So very few people tolerate like an infection really, really well, right? It was so many of these folks that we're seeing now are often people anywhere between usually honestly 16 and probably 55, and it's not the first time they had COVID. It's usually the second or third time they had COVID, but usually within a month, either before or after, something else was going on, whether it was a huge stressor or a head injury, and both of those together diminished their brain strength enough that their autonomic system went haywire. And then if you think about the rest and digest versus the fight or flight system, if the fight or flight system is too high, you literally can't turn on your ability to repair. Yeah. So that's why people get stuck in this phase of not healing. And our job is to basically get them to the point where they can start healing on their own. And then we either say, hey, our work here is done, or like, we'll help you the rest of the way if that's what you want, but we want you to have the tools to manage this and handle this the rest of your life.
Yeah.
And that's honestly for us, that's where the rest of the referrals come in.
Right. And there's an old analogy in the neurology world. I know I use it with a handful of my patients. I'm sure you use it as well. But think about it like a bucket. Everyone's bucket size, which is their resting state of their body, is a different size. So I may have a bigger bucket than Dr. Teams, or vice versa.
Both
Same with everybody in the world.
He's younger, that's
right.
why.
So when there's different stressors in our life, and again, this could be a physical stressor, this could be an emotional, this could be chemical, this could be an infection, that's like water getting poured into the bucket.
Yep.
If there's enough water that gets poured in the bucket's going to overflow, you're going to have your symptoms. So when I go through and I work through cases, I come about it from two different angles. I say, how can we stop all of this water being poured into your bucket? Let's figure out some of these sources to stop this altogether.
Yeah.
But the other side of it is saying, how can we make this bucket bigger?
Right.
So you can handle more stress. If you get an infection, your life's not going to fall apart.
Right.
And that kind of circles back to what we talked about before with having that multimodal application.
Yeah.
Where, say, if you're cutting out gluten, that could be a massive pitcher of water that's getting poured into the bucket, but there may be other things that's contributing to that as well. So if you're able to make your dietary interventions, cut out certain foods, on top of increasing exercise, on top of sunlight exposure, on top of decreasing inflammation, that's just giving you more of a chance to not have that bucket overflow and mitigate all of the water being poured in. And then if you work with another integrated practitioner, you could keep bringing that down and say, what neurologic applications or even what body applications are we doing here to make this bucket bigger? And that, in my opinion at least, is a full care plan.
Absolutely. Couldn't agree with you more. And I think a lot of practitioners do that too. It just seems that the one that people seem to not ignore, they just might not have the tools to know how to work with it, is the neurological system, which I think is why we're so busy.
And I think that's because so many things can affect the neurologic system.
Right.
Like if you look at the kidneys, there's specific things that this is related to kidney. With the brain, it could be different foods you're eating. It could be chemical exposures. It could be trauma. It could be, and the list goes on and on and on.
Like mycotoxins.
Yeah, it could be pollutants.
Yep.
Yeah.
I mean, these days, my joke with patients is, hey, everything's trying to kill us. Let's go after the low-hanging fruit, the stuff that's easy to deal with, which is usually diet. And honestly, mindset is a very low-hanging fruit because you have some control over that, right? And so we talk a lot of mindset with people. Yeah. Going back to what you were talking about with your bucket, I have the same conversation just with a different concept. Well, same concept, different words, right?
Right.
So when we look at everything, right, your kiddos can't necessarily always follow a finger, right? Or to say the least, it's hard to get a VNG on them, right? Yeah. So with adults, we're able to track people's eyes and basically map out their entire neurological function just with an eye test. We use balance and coordination testing as well to kind of complete that. But when we sit down and we talk with them, the first thing I say is, all right, we're looking at your pathways with all of this testing, right? If the pathways, we're going to find out if the pathways work, don't work, or how well they work, essentially like on a scale of 1 to 10, 10 being the best. And most people that come in here are anywhere between 90% on the good side, 90% on the good side to maybe like 40% on the bad side. So But it's like an exponential breakdown the lower you go in the functional world, right? So we talk about pathways, and then all of those pathways have to integrate with everything else. We talk about pathways, integration, and then the last thing is your tolerance, right? How big is your bucket is basically the same thing. And so when we talk about tolerance with adults, they're like, well, I can't walk into a Goodwill or a Walmart without the lights driving me nuts. And so if like I can only be in there 10 minutes before I get light and sound sensitive and I start to get a headache, so I have to leave, right? As an example, we've been working with a patient roughly 3 weeks with dysautonomia, right? Self-diagnosed POTS because she was negative on a tilt test, had to quit her job because she couldn't handle the long hours standing on her feet. She would be in so much pain. She would have so much brain fog, headaches, and nausea, right? I probably just named half the people out there that are like hanging on by a
More
thread.
than half, yeah.
And you know,
it's
we're
yeah.
like, I think we're 3 weeks in. I'm seeing her 3 days a week. And just last week, she was able to go into Goodwill and Walmart without having any light or sound symptoms, and leaving without getting any nausea, and being able to go to the next store. And so for her, she's now thinking of, well, maybe I'll be able to go back to work in the next couple of months. Yeah. So like that's huge.
Incredible.
At the same time, we just concluded an intensive of somebody dealing with functional neurological disorder. And this is a really interesting one because it's now basically they're recognizing, the medical world is recognizing this functional neurological disorder as a real thing, where the symptoms, people basically think they're making them up or it's all in their head. Well, what's interesting about the FND stuff is typically stress or anxiousness tends to ramp their problems up, right?
Yep.
And so because a stress or anxious like psychological thing ramps them up, people get written off and they get meds thrown at, and they basically just they start to circle the drain by the time they reach out here. And we're like, hey, like, let's just map it out and see what's going on, right? And there's almost always at least mild pathway problems. The integration usually sucks, and therefore the tolerance is so low that just leaving the house creates these movement disorders or these vestibular symptoms or dizziness or migraines or anxiety attacks, stuff like that. And we're able to work through with the pathways at a level that they can handle without blowing them out of the water. And over the course of 2 weeks, we can create so much stability. We're not fixing them per se. Some we might, but most of them we're creating that stability and really just, I think, giving them hope.
Yeah, and I think it's important to, I think, expand on that a little bit further, and knowing that the symptoms that somebody's dealing with isn't always so black and white. Like, it's not like you have anxiety because you have anxiety. You could take that a step back and figure out what are the systems in your body, specifically your brain, that are causing your anxiety. Mm-hmm. Where we could relate that up to the frontal lobe and to the
Yep.
brainstem, the amygdala, so on and so forth. And we know that there's strategies that we could do to increase the function of those areas of the brain. As those areas of the brain get stronger, your symptoms then decrease. Mm-hmm. So that's why it's so important to be able to, look at things from a bigger picture, to be able to, because there is a bigger picture to somebody's symptoms than just it's all in your head.
Yep.
And going to a trained functional neurologist, I'm sure there's other practitioners out there that do good work, they're able to figure out the underlying mechanisms of what's translating into the symptoms that somebody's having. And it could be vestibular based, it could be autonomic based, it could even be gut based.
Yep, exactly.
Yeah.
One of the things that I tend to see kind of going on that gut stuff, a lot of people develop gut symptoms, but most of the people with gut symptoms tend to have other symptoms too, mm-hmm. right? I'd say the common stuff is brain fog, anxiousness, maybe some depression stuff, maybe some brain fog. But the most common, like, simple thing to say is their nervous system is ramped up a little bit, right?
And here's the question. Is it the brain affecting the gut, or is it the gut affecting the brain?
Correct. So is it the chicken or the egg?
Exactly.
Right? Well, I think with our approach, we go after both. And so when other practitioners, let's say people who aren't trained in neurology, they do all this awesome, like, gut testing,
Yeah.
genomic testing, whatever it may be, but you don't have the ability to deliver stuff because the brain is not functioning in a way that it's in a healing state.
Exactly.
Right. So
Exactly.
that's why I refer a lot with naturopaths, say, hey, when this person comes in, if they don't have anybody, I get them right over to my trusted sources, and I'm like, hey, here's what's going on. They obviously do their history, they get their piece of it, and they're like, hey, I think this XYZ. Like sometimes when we do that, we realize, hey, this person actually needs to be like in hematology. And so when we can't get enough oxygen to the brain, even with good autonomics, like we have to refer out so that they can get like an iron infusion or whatever it may be to maximize their ability to get blood flow to their brain and oxygenation to the vital areas that would fix the problem. So I'm all for, like, basically what I tell people is I don't care how you get better as long as you get better. If I'm just a stepping stone in that, great.
Right.
I would love to be a part of that, and of course my ego would love it a little bit more. But at the same time, like you've not been doing this a century, so to speak, but you know when it's time to refer out.
Absolutely.
And that's something that you don't learn right out of the gate.
Right.
It's kind of funny when you first get started, you're like, oh, I'm going to refer everything out. I'm scared of everything.
Right.
Then you get really comfortable with it. And then you're like, well, I'm not going to refer out a lot. And that all this happens in like the first year or two. And then you realize you're like, okay, the more I know, the more I realize I don't know. And the more you realize what your strengths are. And so like, I'm pretty well trained in functional medicine. Like I can read all the labs, I can do all the stuff, but my I guess, I don't know how I would say it. The best thing that I do is neurorehab, and specifically working with those patients that have psychological related issues that are contributing to their problems.
Right.
So what I try to help as much as I can within my license, and then I refer them to the right person.
Move forward.
But they couldn't handle that next person until we did the pathway work, right? And that tolerance.
It all builds on top of each other.
Yeah. So
Yeah.
So that, I think that's the thing that I love the most about working with all these cases who basically their life is in the crapper, is they have a family too. And when you help that person, the whole family gets better.
Yeah. I mean, that's why I love, the whole childhood dynamic, because I know I'm helping the kid, but I know I'm helping the family probably even more.
Yeah.
Where when the child's life gets easier, I know the whole family's life in turn is going to get a little bit easier with that as well. And, as we're working through things, we could only do so much in therapy. We set people up for a lot of success within what we do, but there's a whole piece, and I know it is part of it with adults as well, but with kids, there has to be different changes that have to happen at home as well.
Yep.
And that takes a whole family being committed to doing it
For sure.
to be able to make these changes.
Yeah. So what, on that note, how is it working with, say, families with like an autistic kid, but it's a split family? Like, how do you handle that? What needs to happen in that case?
So like the parents are separated, is what you're asking?
I'm sure it's got to be difficult.
Oh yeah. I mean, unfortunately, rates of divorce skyrocket when you have an autistic child, and that's just in the literature. But both of them have to be on the same page. For example, if we're trying to do dietary modification or work through things with supplements, mom's on board, dad says, none of this is real. We're not going to nearly get the results that we would want to get or that we can get if just mom's on board. They spend every other week with dad, and he brings them out to McDonald's and gives them Diet Coke.
Right.
And there's a lot. I'm lucky enough to have a lot of families I work with. If they are separated, come together and they understand that this is for the betterment of their child.
Yeah.
So they work together, and they buy 2 sets of supplements. They have a diet plan they have to follow. They know the exercises they have to do at home. But yeah, it just, at the end of the day, it takes commitment.
Yeah.
It takes commitment to change, and change is not easy, especially when you're trying to change a child's lifestyle. Sure. Because the world that we live in is definitely not advantageous to a developing brain.
Right.
But if somebody is able to put in the work,
yeah.
That gives the prognosis a much higher chance of being successful.
You touched on that developing brain stuff. What kinds of things were you kind of implying that aren't so healthy for developing brain?
Yeah, I mean, it's really an endless list these days, but
What are the main
I would say the
things, like,
number
people that
one,
can listen
yeah.
and that
So
can
I would
make
say
changes?
the number one is probably food, the food that we're eating. Not even the types of food, but just the way that it's harvested and everything is very bad for our bodies. But probably more importantly is the types of food we're putting in our body. There's so much just bad fats we're eating, high sugar, processed foods. When you look at kids with autism specifically, diets mostly are pasta or mac and cheese, pizza, chicken fingers, fries, and a brain cannot work the best it can when there's very poor fuel going in the brain. So being able to modify and work through diet is something that just about every single person can benefit from, whether you have a neurodivergent child or not, or even if you're an adult. If you start eating healthier, you're going to feel better.
Yeah.
The other one I would say low-hanging fruit-wise is just physical activity. Yeah. The brain needs to be activated so it can inhibit itself.
Is this like riding a bike, or is there more to it?
I just want to get somebody moving. Mm-hmm. The two main things that activate our brain is something called the proprioceptive system, which is like your muscle and joint feedback going up to your brain, and you have your vestibular system. Those are two bigger driver of brains compared to, say, visual input and auditory input. So when a kid's going outside and they're playing, they're going to a park, they're riding a bike, they're jumping rope, they're kicking a soccer ball, that is movement happening to our body. And the more input that happens to our muscles, the more that's going to go up to our brain.
Yeah.
The more our brain is on, the more it turns off. So that's why one of the best research things for ADHD is exercise, because the brain's having the activation it needs to be able to regulate itself better. Yeah. And, schools are cutting PE classes.
Thank God I still had PE.
Yeah, I mean, it's really a shame, and people aren't playing outside after school. There's not organized sports as much as there used to be. Now there's Fortnite tournaments and all these things on the phone and social media, which is
games. Yeah, like we're subject to it too, right? Like
it's constant.
If you let me, I will sit there and scroll for an hour, right?
That's exactly what it is.
On your wrist,
and I'm getting it's right here.
You're just buzzing like.
But here we go. Here's the good notification. Time to stand. Stand up and move around a little bit for 1 minute.
Let's do it.
All right.
Stretch those legs a little bit. Woo. So, here? I'm gonna do some lunges off camera here.
I'll run in place.
Right. See, we practice what we preach.
Yeah. Right.
But yeah. We're good.
So exercise is another extremely important one.
Yeah.
And with, kids, a lot of times, and Dr. Karazian said this, and it resonated greatly with me. He's one of my big educators, if you would, in my training. He said, coming up with a plan for neurodevelopmental issues is easy. What's hard is the implementation of the plan. Mm-hmm. Where if you just think about the basics of what a kid should do, that's going to put them on the right path. Make them eat real food, make them go outside, make them interact with people. Don't have them stare at a screen all day. Make them do their homework on time, have structure, have rules within a house. And it's an easy thought. Where the trickiness comes is the implementation of it. But, that's something that people have to make a conscious action and decision to do, because a lot of that comes down to commitment. And I'm not going to sit here and tell people how to parent, but when you're just looking at the core needs of what a human being should be doing on a day-to-day basis, it's very easy to realize that nowadays kids really aren't doing that.
Yeah, totally. If we were looking at a needle, right, like to the right side is the green side, the good side, to the left side is the bad side, right? Like if we're talking about video games, if we talk about social media, if we talk about like the gaming stuff, to me, it's like it got out of hand a long time ago. Granted, I played games when I was a kid. But at the same time, I also was outside in all the organized sports. Like we didn't have flat screens when I was growing up, right? We had to go to Blockbuster and rent stuff, and we only got it for a day or two, and we'd have to rewind it.
Yeah.
We don't have Netflix like we have now.
Yeah.
But working with kids, like when I say kids, I'm talking usually like high school kids. So they're not adults, but they're not like kids either that you would work with. And some of these kids that are gamers, their entire social network or friend network is online.
Yeah.
Right? They see each other at school.
And it's only going to get worse is the scary part.
Correct.
With these new VR goggles, people aren't going to have to leave their house for school, for anything.
It's crazy. We're becoming so visually dominant that we lose the function of the rest of the stuff, right? So in neurology, we have a saying, if you don't use it, you lose it. Right? Like if you learned a language in high school, you studied abroad for 3 months and you didn't go back for 20 years, like you're not going to remember every word. Right. You're not gonna be that on top of it, right? That's why practice, I think, you can say perfect practice makes perfect, but if you keep doing stuff, you're gonna create some neuroplasticity, right? Yeah. And on the flip side, if you keep doing the wrong things constantly, you're going to develop a really bad habit, and it's going to be really hard to break those habits because most of those habits become addictions in some way, shape, or form. Right. Sugar, loud music, gaming, saying no, getting in fights with parents, all sorts of stuff, right?
Yeah. Let's take that one step further. With the way that kids are exposed to, we'll say video games, but this includes TV shows nowadays. It's such constant, immediate gratification. Yeah. You go through level 1, you get 3 gold stars right away. You're watching a show, the frame changes every 3 minutes. And this just causes the brain to almost rewire itself to search out that immediate gratification. It takes away that whole hunter-gatherer mindset that really how we evolved and developed. Right. Where when you go out and, or if you're reading a book, that's something that our brain should be okay with doing without getting sent over the top or being bored with it, compared to, going on Snapchat and loading your phone and being excited every time you see someone sending you a message. Right. It's not always going to be that immediate gratification just in life in general. Yeah. And when people start searching out these immediate gratifications, that brings them down a bad line of, say, addiction. Yeah,
like dopamine drive.
Exactly.
Right?
You're getting that dopamine rush of saying good job every 5-10 seconds.
Yep. It's
so yeah, the people that develop this stuff, they are all extremely smart people. And, I was reading this one thing the other day, and do you know who Netflix said their number one competitor was?
Who?
Sleep.
Wow.
Yeah. So their whole job is to not make you fall asleep. Someone, I don't know if it was a CEO, but someone high up, they said their number one competitor is sleep.
Wow.
And that's just how these big things run.
Holy cow.
Yeah.
How many subscribers do they have? Like 100 million, 200 million?
But every single application, whether it be Amazon, Netflix, Instagram, TikTok, its whole goal is to keep you engaged in it.
Wow.
That's how they make their money. That's how you become addicted to it. And that's what disconnects you from the real world. And what we need, especially nowadays, is to be more connected to the world. Yeah. And that's why it's so important to limit screen time, limit phones in kids, even with adults. And it's a shame, but people are addicted to their phones. And, you look at people's screen times, they're on their phones 9-10 hours a day. And it's scary.
Yeah.
People get addicted to cigarettes and that stuff, and it gets blown out of proportion, but people are addicted to social media and all that stuff. And it's scary because it's only going to get more engaging.
Intense, more intense.
Yeah.
They say years ago, they started saying sitting is the new smoking. And now everything is done sitting. Everything. Like, unless you go to the gym. And here's the other thing, right? So seeing adults, I see a lot of people with disc issues too, right? Whether it's from degenerative changes, from traumatic things, from sports, from car accidents, doesn't matter what it is. But the vast majority of people that we see that aren't based off a traumatic injury are from people that sit. And, you go to the gym for even 2 hours a day, you're still sitting 8 hours a day at work. And then you go home and you watch Netflix for another couple hours. I don't know what it's like with kids. You're probably a lot busier than that. But, the vast majority of the time that we're awake, most people are sitting. And that is not good for our low back. It's actually terrible, just as bad for our brain, right? Because like you were saying, as a kid, we need to be moving and interacting with our environment. And basically, we kind of stop doing that when we get a job, like depending on what job it is. That's why. So I had back when I graduated high school, my friend's mom had a business, and she's like, hey, you should come work for me for the summer. I worked there like 6 weeks, and I was going absolutely bananas because I was stuck in a cubicle, and I'd like get up and walk around, and I'd go bother people because I'd finished my work. And then I'd be like, hey, does anybody else have anything for me to do? And they're like, they literally said this to me. They go, you were supposed to save that, and that was supposed to keep you busy all week. Like, I don't have anything else for you. Right. I'm like, what? Is this the world that I'm going into? So, you know, I'm thankful that I was able to go to school, get a degree that put me in a clinic where I'm basically up and moving all the time. And the only time that I'm sitting is when I'm taking a history and trying to figure out people's issues. Yeah. And the rest of the time we're doing rehab. We do all of the vestibular work, the ocular motor work. You know, we talk, I give people books to read on psychology and negative self-talk. And then we incorporate, when it's time, physical exercise, cardiovascular exercise. And then that's, if we need to, we refer them out to kind of do the icing on the cake. Yeah. But so as an example, we talked about movement. So right before Christmas, somebody gifted me like a refrigerator. It was like a nice French door refrigerator. So me and the other guy, we move it from Phoenix down here on a rainy day. Remember how it was raining multiple days? So we get it down here and we wheel it in, and it doesn't fit through the front door. And I'm like, you got to be freaking kidding me. And so we load it back up, and I was like, listen, I'm not even going to worry about it. So I take it home. He goes home. And I pull this thing out of my truck, and I put it in my shed all by myself. And the next day, my arm is like so sore, I can barely lift it. And I'm like, what the hell? So generally, I'm not injured. If I get injured, I cry about it for a day, and then it's usually fine within a day or two. This has been going on almost 2 months now. And so I'm like on the verge of, I keep forgetting to call about it, to basically schedule an MRI on my arm. But just bad, this, huh? Oh yeah. I mean, I've had.
So I've been around for all your little tweaks, I won't mention how we got the one of them.
That was fantasy football related.
Yes.
And so, you know, so I've been getting worked on. I've been getting adjusted. I've been getting soft tissue done. I've been getting injections, like pain management injections, call them trigger point injections, all through my forearm and my bicep. And I've been doing all the Prolo. I've been doing everything, and laser, PEMF, you name it. I've been doing it all. And the more I'm researching on this, I'm pretty sure I had as bad of a strain that you could have without tearing the muscle. And I'm looking at like grade 3, like takes 2 to 3 months to heal on its own. Like when you mess up that tendinous junction, dude, that's all I could feel. So,
I had tennis elbow. It took me around 3 months to
it's no joke.
Get rid of it.
And so like when people come in and we're like, oh yeah, we'll have that fixed up in a couple weeks, right? You know, we often find that it's more in depth of a problem than we originally thought. Yeah. And so becoming the patient again was really nice for me. It really put me back in not the driver's seat, but the passenger seat for a little while. And thank goodness I was able to bring on Dr. Rachel in January, because she's had to do some adjusting for me. Like I haven't been able to adjust necks very well with my left arm. So she's been adjusting low backs and necks on the opposite side for me. Like I'll do one side, then she'll do the other side. And so just the last 2 days, I've been able to go real light on working out.
Wow.
But the whole point of this story is for the last 2 months, I haven't exercised. Right. So I went on a hunting trip after Christmas, and I kind of flared up my knee. And so I had both the arm and the knee on the same side. I'm like, all right, I'm done for a while. I'm just going to let this cool down. And so now, talk about neuroplasticity, it's become a habit to not get up and work out every morning. And so I'm lucky that my genetics don't allow me to like put on a lot of weight when I stop working out. And I never have to trim down. I usually have to trim up. And so luckily, like with a physique, I'm able to like walk around pretty much looking the same, but I don't feel the same.
Right.
Like my energy levels have been lower. I'm still firing on most cylinders, right? But it's that extra edge from lacking working out, which has like totally changed the way I felt over the last 2 months. So this morning I did a little half-ass workout, and like I'm not hurting from it on my arm. So tomorrow morning is gonna be, I think, my first day back to F45 in 2 months, and it's gonna kick the shit out of me.
Yeah, I mean, I don't mean to brag, but I've kind of been the opposite these last 2 months.
Oh well, it sounds like he's bragging here. So
no, but end of last year, I've just been very busy with growing the practice, getting all my online stuff squared away, my online programs. All the holidays come around, and I've just haven't been taking care of myself as I should, just because my brain's doing a million other things. And, you know, you see symptoms come up that you say, oh, I would never deal with something like that. So come January 1st, I decided I'm going to, you know, flip everything around and get my priorities straight and start exercising as I should be, eating a lot better. I ran a bunch of lab testing on myself, kind of the whole 9 yards here. And these last 2 months, I've had more energy. Our practice is busier than it's ever been. I'm getting more stuff done at home. In a week or two, we're about to launch another online program. So, and I could tell how much better I feel now compared to November, December.
For sure.
And I'm not doing all sorts of crazy stuff right now.
Yeah.
I'm eating better. I'm sleeping better. I'm exercising, and I'm taking a couple supplements.
Yeah.
And just by hitting those low-hanging fruit, I'm feeling night and day better. And people always say, you know, this stuff it can be pretty expensive, but it could also be absolutely free. It's free to sleep better. It's free to go on a walk outside. It's free to get some sunlight.
Right.
It's you know.
Now, while it might be free, like we do this for a living, so we understand what triggers are, what stressors are, where we should and shouldn't cut things out or add things in. And that's where a lot of these folks that are listening, they're like, well, what do I do? Right. And so what I'm going to do is I'll rattle off a few things that I think are really beneficial to try to get you back in towards that kind of firing on all cylinders thing. Yeah. So the first thing that I would do, right, it's tougher in the winter, but the first thing I would do is as soon as your alarm goes off, pop up out of bed. Like, don't like roll and groggle. Yeah, groggle, I don't even know if that's a word, but like, you know, you're groggy and you're just like slow moving like a sloth getting out of bed. Well, usually in those slow moments are when we're telling ourselves, oh, I don't want to get up, right? That's the first thing out of most people's mouth or in their mind. So the first thing that I usually say is, I can't wait to get up and get to work today, right? Whether work means physical work or like work out or get some stuff done or get the coffee started or whatever it is. It's like, you know, I'm excited to get the day going, right? I love my job. I love this. I'm excited to make coffee for my wife. So instead of saying, I don't want to go to work or, ugh, do I have to, like, how many patients do I have today? Like, some people do that, and that like starts your day off on the wrong foot. So the second thing I do, if the sun's out, I try to get outside, get sun on my face for 5 to 10 minutes, usually while drinking my coffee. I'll try to read a book if I can. If not, I'll try to work out. The other times I'll usually just hang out, just kind of, I try not to scroll, but I tend to check emails first thing in the morning. And then in the evening time, what I'll try to do is use my red light, right, that XTI light, and I'll put that up right in front of my TV. So if the wife and I, or whether I'm working or we're hanging or doing dinner or whatever, watching TV, I'll have that light on and exposing myself for probably, I don't know, an hour or two. And so it starts activating the melatonin pathways and the sleep pathways. Right. So since I've had that light, which I've now had for 2-3 months, my sleep has been generally better than ever. This last week, I haven't been using it as much because I was telling you I was a little tired this week. But when I use that, it drops my sleep into a whole new level of, I guess, depth of sleep. So like when I use that, I dream like crazy, and I don't wake up in the middle of the night now. And so more in the last month, maybe 2 months, I've woken up to my alarm, where like the previous 5 years, I was usually waking up between 3 and 4 in the morning. Right. Just without it. So, what kinds of things? Obviously, exercise and things like that.
What I would
other
say,
things, like low-hanging fruits, can people do?
I've been doing 10,000 steps a day, and I love it. I feel night and day different on days that I get 10,000 steps versus 3,000-4,000 steps.
For sure.
And if you're working a desk job, I guarantee you're getting under 5,000 steps a
Dang,
day.
that's not very
And
many.
you don't even realize. You get an Apple Watch, get any sort of pedometer, and you'll see how little steps you're actually getting.
Yeah.
And what's nice about 10,000 steps is that usually requires you to take, if you don't have an active running around job, 1 to 2 20-ish minute walks a day.
Okay.
And this could be in the morning, this could be at night, this could be during your lunch break. What I've been doing is whenever I have a phone call, I pace around my parking lot.
Yeah.
And that just gets me 4,000 steps right there.
Yeah.
So that is something I found very, very helpful. I also try to meditate every morning. And that may even be just deep breathing.
Yep.
I do that through one of the iPhone apps. And I don't love doing it. I don't do it every week. I'm not perfect with it, but getting a cold shower in the morning definitely gets you going. I'm not the biggest fan, or
I don't love cold either, man.
I hate the cold. I wish I was a cold plunger, but I've done a couple and I feel good after it. But if you're able to do 10 seconds of cold, that always gets me going for the day.
Yeah. So talking about breathing, quick coming back to kind of work-related stuff, a lot of these folks that have that nervous system that's just through the roof, we have doing deep breathing, right? And like for you, I'm sure you probably even have your parents doing it of your kiddos. But when we deep breathe, right, we activate, we're basically overriding the natural state that you're in, which is kind of a fight or flight state. And so we have to purposely execute a decision to do this breathing pattern. And so we activate our prefrontal lobe, and then that fires down to overactivate the respiratory centers, which then inhibits more of that fight or flight response, right? It doesn't happen right away, but the more you do it, the better you get at it. And so usually we go with a 5 inhale and a 15 exhale. So that's a rate of 3 breaths per minute. And the reason we do that is because the guy that developed our vagal nerve stimulator, a PhD, did his thesis study on all forms of different breathing and HRV. And so different breath patterns change HRV, but certain breath patterns calm people more. And so usually we use a 5-15, as well as people can use lion breathing. They can do all sorts of different breathing, but for the purpose of calming the nervous system down, we specifically do that 5-15. And so depending on how intense that stress is, like if I say rate your nervous system stress from 0 to 100, most people that are in this office are between 50 and 90. And so I have an algorithm that we use in the office after I take their history. But generally, we start people with 50 breaths a day. And so if you can do 50 of those 5-15 breaths in a day, you're going to start making changes in your nervous system to calm you down. So if you're not getting sleep, right, and at the end of the day, you come home and you're just like, right, you're just venting like crazy, whether you're single, married, kids, all the things, I recommend trying to take like 10 to 15 minutes and just breathe, right, shortly before or right before bed. And with that, you want to try to reflect and be grateful for things. So it's like a form of meditation. And just say, you know what, I'm thankful that my kids are healthy. I'm thankful that I'm able to provide for my family. I'm thankful for whatever resonates with you. And so that's kind of one thing that I want to leave people with today is you got 2 docs that deal with 2 different demographics, but the therapeutic intervention is very similar, right? We try to remove the things from the systems that are causing the problems, and we try to add the things to the system that are clearly just generally healthy, and then the neurological application and laser application just becomes that icing on the cake, right? That last 20% that needs to be absolutely customized is really where, if you're doing all the other things, they're going to have a very fast outcome in the office. But if they're not doing the other things, it's just going to take a little bit longer, right? So we become that coach to expose them to the things that they need, right? And so, so for all you listening, make sure you're getting your sun in the morning. You can watch it set. Make sure you're doing your breathing. Dr. Bor, stay active. Take some supplementation, meditate. And honestly, like for me, mindset and just not allowing yourself to go negative is so freaking huge.
Gratitude journals,
oh my
all of
gosh.
that stuff.
And if that stuff is like foo-foo and woo-woo for you, just So we give people a book. It's like a $3.75 book. It's called Negative Self-Talk and How to Change It. You can find it on our website and just click the link. It'll take you to Amazon. But it's like a 60 to 90-minute read. And it basically is this dude that's been doing this like therapy work for 40 years, helping you understand what negative thoughts really are and then how to change them just a little bit. Right? It's not like these massive changes, like you have to be the most positive person in the world. You have to fake it till you make it. It's like, just don't say certain words, right? Like the I can't or I will try. Instead of I try, like to me, that's kind of that's leaving the door open for I don't want to do it, right? And so like if I'm going to do it and then you tell someone, now they're going to keep you accountable for it.
Yeah. I mean, I actually, just this morning, I signed up with a accountability coach it's through this website. Just had my kickoff call this morning. So
Nice.
me and him are working through a couple goals, couple plans, and yeah, we're working together just to hold accountable and,
For sure.
you know, keep me on track.
Yep. Yeah, that's awesome stuff.
Yeah.
So, all right, we've probably talked enough work stuff. How's your golf game?
Truthfully,
Let's
I
hear
bought
it.
a new set of clubs. What was it? Black Friday.
Uh-huh.
My buddy who I grew up with, best friend in the world, came out here to Scottsdale, and we played around. And the first 5 holes, I didn't get a ball in the air.
Oh dear.
It was one of those days. I was dribbling, I was chunking. It was so not good.
Yeah.
I haven't played since then, and that
Nice.
was a month and a half ago.
Well, we
not
keep
good.
threatening to get out there and play together, but you know, with our schedules,
yeah.
it's tough. But
Which I'm kind of happy about because I don't want him kicking my butt.
right.
He's a good golfer.
So I used to do long drive back in the day, just grip it and rip it, and you got to hit it inside like basically a football lines. And like my longest drive on record was like 376 yards. These days, I'm lucky if I can hit it 300. But depending on the day and how loose I'm feeling, I can go low. If I go low, it'll be like a 75. If I go high, we're talking like 84, 85.
If I go low, it's 97. If I go high, it's 120. And it's sad because I've been playing golf for so long.
But I'll tell you, it's a great time.
Oh,
Usually
I mean,
the
we
higher
always
those
have
numbers,
fun.
The more beers there are.
We
right?
always have fun.
Yeah.
That's never to quarrel with.
So maybe one last thing here. You mentioned a little bit about something that you're going to be launching, maybe an online program.
Yeah.
What can you tell me about that?
So we already have a couple online programs out there. Essentially, it's actually very similar to what we talked about today, where it's the 6 pillars of optimal neurodevelopment. So we dive in through lifestyle, through diet and supplementation, through primitive reflexes, through physical exercise, cognitive exercise, etc. And I essentially just walk people through how to implement that in their lives.
Yeah.
So we've had that program out for a little bit. This new one that's launching is going to be a little bit more accessible to people. We're going to be doing monthly Q&As within there, and then just information that people will be able to practically use. So I just want to give people I know we've said it a bunch of times this podcast, but the low-hanging fruit that they're able to implement in their life to be able to move their child's life in the best direction that they can.
So who is it for? Do you have a demographic in mind?
Mostly parents.
Okay.
Parents
for themselves or parents for their kids or both?
It's for things that parents could do for their kids.
Okay.
It's not like a kid's going to be watching the information on there.
What kind of kids, are the kids going to be dealing with things specifically? Like who, if somebody said, hey, who is this for? Like,
so the principles in it can be used for everything from a neurodivergent to a neurotypical child, where if somebody has quote unquote normal development, they could still use these principles to help maximize, their path forward. Optimization.
Okay, cool.
But if somebody's on the other end, say with, autism or brain injury, they could begin implementing some of these ideas to help maximize, their child's development. And, it's going to look a little bit different for everybody,
Sure.
but at least applying these principles will help to get the ball from a therapeutic standpoint rolling in the right direction.
For sure. To me, it sounds like individuals or families that have gone through the medical route of, say, autism, this would be a really good place for them to start.
Yeah, it's a great starting point. It gives you the nuts and bolts that you need to ultimately feel confident going forward. Because we'll say the autism world specifically, there's a lot of noise out there. Take this one magic supplement and your child will start talking.
Right.
Do this one therapy for 2 visits and your kid's going to become verbal, whatever it may be.
Yeah.
And within this program, again, it goes back to how do we create this complete plan rather than just saying, here's the one thing that you have to do that's going to be the cure for everything.
Yeah. Which, that kind of the specialization, especially in the medical world, it's like you have 5 different specialists by the time you're done with somebody versus one practitioner or one program that can really cover a lot of the bases and really get you moving forward.
Yeah, and even just from an educational standpoint, we've had already some guest speakers already loaded up within the program. We've had OTs and, other people in our world that all have their own ideas and their own applications. And if you're able to just be more educated, then you have a lot more confidence in the plan you're taking forward.
Yep. Right on. So, Doc, how can people get a hold of you?
So we have our Instagram account as Dr. Connor Bor. We post a lot of different educational stuff, just some real action footage of our clinic in there. And a lot of people have questions about the applications of what we do in our clinic. And honestly, I feed a lot of people right to the Instagram because they're able to see things in action, and it makes a little bit more sense from there.
Sure. Do you do consults or anything?
So we have a consult within our practice setup. If you get a hold of our practice, and there's 1,000,001 different ways to find us, call in and our front desk will coordinate how to set up a consult and what that looks like. And then from there, we start out with our initial assessment, our initial program, and we figure out what the best step forward is from a care plan standpoint, whether that's hopping right into care, whether that's running labs first, whether that's trialing out the laser. A handful of different ways to go with that. So getting that initial assessment squared away figures out with confidence what step we're going to move forward to next.
Right on. And so, okay, perfect. Well, what's the website name?
Is neuroactivecenter.com.
Okay. Dr. Connor Bor.
Yeah. What else?
I don't know. On IG, Instagram, Facebook.
Did you forget my name?
No. Are you doing? I'm trying to think of the tags.
Yeah. So it's Dr. Connor Bor.
Okay. Same with Instagram,
everything.
TikTok, all the things.
Yeah.
Cool. Awesome. Well, let's see. I don't think I have anything left, but I appreciate. Well, thanks for finally, having the time to get together. I know you're busy just helping all these patients, so I'm glad we got to sit down and talk about this stuff and give some things to parents, give some things to kiddos, and also I appreciate all the adult referrals you send me. I've actually got to send Brittany a thank you letter for sending that functional neurological disorder because I guess they're actually related in some way. I'm going to be sending her a thank you. She wanted a Desert Brain and Spine hat because she doesn't have a NeuroActive hat. So maybe I'll hook her up with one of those. But it's I feel like we got a pretty cool working relationship where you are really focusing on one group and I focus on another group because a lot of those parents are like in that dysautonomia world because they're so stressed out taking care of their kiddos.
A collaborative effort is really the best way to do it, putting down everyone's ego and just saying, how could we make this patient better? I don't care if it's with me, I don't care if it's with that person, because the more people we get better, the more people we have the opportunity to help on the back end because we're getting people.
Yep, for sure. Well, thanks again, Doc. I appreciate it. It's good having you here. We'll have to set up a round of golf. Maybe we'll do like a NeuroRESET live from the tee box. Can you imagine? We'll get a live view of the top off.
Gosh.
So, okay, real quick before we go, I got 2 things. One, this guy was at my bachelor party, and I think he actually hit a ball backwards.
It was an upslope.
There was a gust.
No, it wasn't a gust. It was an upslope, and I topped it, and it dribbled, and then it rolled back.
Oh boy! So I had to do
Not
that.
good.
I had to do that. The second one, and it's the last question I'm going to ask, is it's a fun one. This one we've talked about before, but I don't remember your answer. What is the biggest animal you think you could fight with your bare hands and win?
Oh, goodness gracious.
Do you remember this?
Yes. I want to say we went for a while about a deer,
I think
and we
so.
said deer's a no-go.
Yeah, I would. There's no way that I would. I've seen how powerful deer are, and there's no chance with any antlers.
Oh no,
that
you know what we finished with?
What was this?
Manatees.
Yeah, that ain't happening. Those things are
They can't.
massive.
Well, it comes down to they can't attack you.
I guess so. Yeah, I guess so.
A deer could attack you. A manatee.
Mhm.
I know manatees are in danger. I'm not saying to go kill manatees. Don't get me canceled for this. But
No, it's just a fun question.
What do you think?
Oh gosh.
Can't take my manatee.
No, it's not going to be in the water. Definitely not going to be in the water.
I don't even know how you.
I would say a dog,
Wow.
a good
That's messed
sized
up.
dog, but I wouldn't because I'm a dog lover. You've seen my dog, you know, Mr. Bogues. Yeah, I don't. I mean, thinking about it, I could do a deer without antlers. That I could do.
They're so powerful. I don't know.
Yeah,
But they don't have a good attack
yeah, it
mechanism.
just depends if you
That
sneak
always
up
comes
on them.
back.
If you sneak up on them, maybe. But of course, it's catch and release, right?
Right.
Yeah, absolutely. So, all right. Well, this is kind of concluding our NeuroRESET podcast here. This is Dr. Connor Bor at NeuroActiveCenter.com, Instagram, Dr.Connor Bor.
With an E. not
With an
O.
E, CONNER
ER.
BOR.
Yeah.
Give us a call if you're on the fence about having your kids looked at for anything. I think just having an initial evaluation and getting some feedback from this guy would be a great step forward. And like he said, get the ball rolling for you and your family. So I want to thank you again, Doc, for being on
Thanks
here.
for having me. This
Had a
is
great
exciting.
time. It's great reconnecting. And right as I sat down and I was moving this microphone, I realized I didn't put in any deodorant for the day. So
That's
I'm gonna
what I
have
was
to go
smelling?
do that. Yeah, I'm gonna have to go do that after
Makes
this.
sense.
So. All right, guys. Well, thanks again for listening to another episode of the NeuroRESET podcast. We'll catch you next time.